Hi, so you're in clinical class now and you're a bit confused what to do, what to expect, what's expected of you. Don't worry, I got you. And in this video I'm going to be giving you guys tips on how to survive your clinical rotation, your clinical classes, and I hope this video is helpful to you, so keep watching. Hello everybody, welcome back to my channel. If you're new here, you're highly welcome. My name is Zara. I am a 5th-year medical student studying University of Nigeria, West Africa, and I film videos about medicine, vlogs, study tips, productivity tips, and lifestyle. If you're interested in that kind of content, please consider clicking the subscribe button below, and also give this video a like if it's helpful to you at the end of the day, and leave your comments down below also. In this video, I'm going to be telling you guys tips on how to survive your clinical rotation. These tips are very helpful, and they're very high yield, so do watch to the end to get the entire information. The first tip I will give you, and the most important tip, is to be present. Medical school, unlike every other course, requires your presence because you're dealing with human life at the end of the day. When you're done with school and you probably start your house job or you start residency, you will understand why being present in medical school is so important. So be present. Be present for your classes, be present for your rotations, be present for your surgeries, present for your clinics. Whatever it is you have to do as a clinical student in medical school, be present. A huge bulk of medicine is clinical, is in the practice, not in the theory. The theory helps in understanding, but the clinical helps in, applying that knowledge that you have from reading. So be present, attend your rotations, be intentional about being present for your rotation and every other thing you have to do as a clinical student in medical school. The next tip is have a learning mindset. This is very important. Nobody can pour a learning mindset into you. Nobody can force you to have a learning mindset. It is something that you have to do. It's your mind. It's you that will set it. I can't come and set your mind for you. So have a learning mindset. This is very important, because after medical school, nobody is mandated to teach you anything. Trust me, nobody is mandated. But now you're in medical school, you're paying your school fees, your consultants and your lecturers have a responsibility of impacting knowledge in you. But after then, nobody is responsible for you, my darling. Anything you want to find out, you have to find out by yourself, for yourself. So after medical school, nobody really cares whether you know anything or not. You will be appointed to patients to handle, to manage, to treat. So have a learning mindset and grab as much knowledge, as much information as you can get now from your superiors. Okay, so have a learning mindset. It is very important. The next one is to pre-read before every rotation that you have. For example, if you're in internal medicine and you're going to be rotating around the nephrology unit, try and check out what nephrology is about. I know you may say, oh yeah, nephrology is about the kidney. I knew anatomy, I finished physiology. Yeah, so I know everything about the kidneys. No. Try and pre-read before every rotation, starting from the anatomy to the physiology, then to the pathology, knowing what are the common symptoms that somebody with a nephrology case will present with, or somebody in the nephrology unit will present with. For example, flank pain. What's flank pain talking about? What is suprapubic pain talking about? What's really going on? Then read about some common cases that you see in that unit. It might not be like an in-depth reading when you're trying to understand. You're just trying to get common terms that are used. One, you're trying to understand what is what. So when you go to the clinic or when you go to the wards and you see these things, they make sense somehow. So pre-read before every rotation. Have no bias. Yes, I know when you're getting into clinical class and you're getting to a particular unit, there's always this tendency to want to know what to expect. At least for me, I always like to know what to expect. I'm like, okay, I'm entering this new unit and this is person in this unit. Is there any important anything about this person? Are there assignments? What exactly is expected of me in this unit? That is very important to do, but have no bias, because when you're inquiring about something, people will always have something to say, and sometimes they are not so positive. So you have to learn to have no bias. For example, if they're talking about a unit, if you're talking about a consultant, just gather your own understanding about this person or about this thing by yourself. Don't depend on people's perception or people's knowledge. Build your own understanding. Oh, they said this man is this, but I'm not going to think about it. I'm just going to be me, do my best, act as if I didn't hear anything about this person. It's sometimes hard, honestly. It's hard, honestly, when you've heard so much about somebody and you just want to forget about it. It's hard, but you have to be intentional about it, because when you start having bias towards a particular person or towards a particular thing, two things happen. Either you refrain from that person or you start talking about the person. So have no bias in clinical class. Have no bias, because you don't know, you may just be so graced that the person might actually pick a liking in you and teach you everything that you are supposed to learn. You understand? So have no bias. Just go with an open mind and an open heart. Whatever you see, you take. Build your own perception about people as you go in clinical class, and about things also as you go in clinical class. Have the necessary equipment. As a Nigerian medical student, we're expected to have certain things as a clinical student. I'm going to have a video coming up soon about your clinical materials and what you will need as a clinical student. When that video is up, do well to engage and watch and like, and also leave your comments in the comment section. That's why you have to subscribe if you have not subscribed, so you can get notified when I have that video up on my channel. So yes, have your equipment, from your stethoscope to your sphig for checking blood pressure, to your tendon hammer, to your pen torch, to your... Just find a list of... every school has like what they need as in clinical class. Your scrubs, your lab coats, usual, but have your equipment. And whenever you're getting a particular unit, there's some equipment that are very, very necessary. For example, if you're in ophthalmology, you know you have to go in with your pen torch. If you're in orthopedics, or you're in rheumatology, or internal medicine in general, you know you have to go with your tendon hammer, you have to go with your sphig, you have to go with your... just have the necessary equipment and tools you need for your clinical rotation. Why? Because sometimes when you want to do like clinical examinations, you may not be so lucky to see someone who has, so don't depend on others. Have yours. So when you want to perform some clinical examination and some elicit some findings clinically, you have your equipment and you're not waiting for somebody to get there, so you're not waiting for the hospital to provide for you. So just have your equipment. Yeah, very important. Click. Take history, do physical examination as much as you can. Throughout medical school, throughout your clinical rotations, you're going to be taking history, you're going to be doing general and physical examination. Then maybe close to your final year, you should know how to long case. Basically, long case means the entire management of a patient, from they are walking in, you take history, do general examination, do investigation, possible diagnosis, differential diagnosis, definitive diagnosis, drugs, treatment plan, whatever it is. That's a full long case, and that will be like close to your final year ish. You should already learn how to do that. But you see, history taking and general and physical examination, it is very, very, very important. Consultants, lecturers, senior registrars, house officers, senior colleague will tell you that these two things are like, I've forgotten how many percentage it used to be. I don't know if it's 50% of getting the diagnosis right and treating the patient. But when you take a good history and you do proper examination of the patient, you're halfway to making that patient better, if possible. Yes. So take history as much as you can. Don't run away from history taking. Oh my God, I remember when I started my clinical rotation, I was running away from history taking because I felt so insufficient. I felt like I didn't know what I was doing. Yes, it is necessary for you to not know what you're doing. That means you're right. That means you're supposed to learn more. You're supposed to learn better. Do you understand? So take history. Don't let, oh, I don't have so much knowledge about this. they say it's pain, I don't know how to clear pain, what am I supposed to do? If you have a clicking guide on your phone, open it and be asking the patient, okay, so is it worse at night, characterize the pain, this. Take history. Push yourself out there to take history as much as you can. Medical school can be very exhausting. Clinical rotations can be very exhausting, to be honest, that sometimes you're really uninterested with whatever is going on there. But every day, just come with the mindset of, I want to learn. And the quicker I learn, the quicker I leave this place. So take history, do your general examination. The truth is that in this part of the world, in Nigeria, we're actually very lucky to have a student-doctor-patient relationship. Because most countries, actually, they don't allow their medical students, their student doctors, to touch their patients. So you're very lucky to have like a one-on-one encounter with patients. Do you understand? So taking history and doing physical and general examination should not be a hindrance because the patient says you should not touch them. It doesn't happen in Nigeria. Every patient in Nigeria wants to be touched by a doctor, to be honest. If you don't touch them, they'll complain that, you did not see me, you did not examine me, and this and that and that. So take history. Like, I can't emphasize this as much as I can. Take history and do general examination. Most of your exams will be based on how much you can take history. I can tell you vividly that my first ever clinical exam, that was M1. M1 was history taking. My first ever clinical exam, I did well because I was always taking history. Like, my first ever posting or clinical rotation was in surgery. In surgery, I was avoiding anything history taking. But in surgery, history taking is not like so in depth. It's not like they are digging into the patient's history, the past, the present, and the future. No, but internal medicine is very, very important. And internal medicine was my next rotation, and I was taking history. I was asking questions. I was putting myself in the front. I don't really care what people think. You're too forward, you're too this. That's your business. That's your damn business. My dear, take history. You don't come to this school with anybody, okay? So take history, do general and physical examination, do all you have to do. So when you're leaving medical school, oh my God, when you're leaving medical school, you're proud of. I want to tell you a brief story. So I'm almost done with my elective posting, my external elective posting. And I met somebody from my school in the place that I work. And she's so good because of probably how well she used herself as a medical student. She's so good. Like, I won't say she's so good and she doesn't have flaws, but she's good. Like, she takes history well. She knows how to do certain procedures. Like, she's good. It's because of how well she put herself in learning position while in medical school, I guess. But yeah, be so good. So when you come out, like, you're proud of yourself first before anybody is proud of you. Do you understand? So have a learning mindset. Take history, do general examination. You're lucky, my dear. You are. Discuss clinical cases. If you're lucky enough to live around your classmates in medical school, because usually in medical school, the medical school hostel is for medical students only, medical and dental students. So if you're lucky to be living around your classmates, have a discussion group, discuss clinical cases, clinical scenarios, because usually that's how your final exam will be, honestly, is a 6-year-old, a 21-year-old, a 65-year-old came with this, that. They're mostly clinical scenarios. So discuss clinical cases. Even if you feel like you don't know what you're doing or you don't know what you're saying, still discuss clinical cases and practice on each other. Do general and physical examination on each other. Yes, do general and physical examination on each other. Take history from me, even if it may not be so sufficient, because obviously this is you're stimulating the history, is not real to get. But do general examination, know the normal. Discussing clinical cases and doing physical examination on your classmates or your friends will help you know what the normal looks like, will help you know what the normal is. So when you see something that is not normal, you know that this is not normal, even if you don't exactly know what is going on, but you know that this is actually not normal. Yeah, guys, these are the few tips that I have for you to survive clinical rotations. These are very, very important and very, very necessary tips. Oh, one more thing, and in fact, one of the most important, I'm not saying it's the most important, but it's one of the most important. Go to your clinical rotation with a mindset of not being bothered by insults, because your consultants are human beings. They may have bad days, or they may just be how they are, and sometimes you may feel insulted, you may feel ashamed. Go into that posting, go into that rounds, go into that clinic, go into that operating theater with the mindset of not being insulted, even not feeling insulted even after being insulted. Okay? And try to answer questions even though they will insult you. That thing that you failed, you will most likely never feel it again, especially if you were insulted or if you were mocked. You will most likely never feel it ever in your life again. So answer questions and don't feel insulted by an insult. That is the national anthem of medical school. So yeah, guys, this is the end of the video. I hope this video is helpful to somebody out there who is confused, and I hope that somehow you're not so much confused anymore. And yeah, guys, this is the end of the video. Don't forget to like this video if this video was helpful to you. Click that subscribe button if you've not subscribed already, and leave your comments below if you're a medical doctor, if you're a senior medical, if you're a medical student, and somehow there are things you've done to survive clinical rotations. Do leave them in the comment section. You don't know who you might be helping. And yeah, guys, this is the end of the video. I will see you guys in my next one. I love you as always. Mwah. Keep being amazing. Bye.